Dr. Pilkington, Shasta is hurt.
Oh no! Sorry to hear about that, Shasta. Oh gosh. Well, good news is this looks like a scrape. So I think we'll be able to take care of you well today and teach you how to take care of this so that next time, hopefully you don't have to come in and see us. All right, perfect. So the first thing you want to do is make sure your hands are clean. So you want to wash your hands really well. That's right. You want to wash your hands long enough to sing 2 happy birthdays or 2 ABCs. And that should be enough to get those hands nice and clean. Here, I just used antiseptic wash, and I'm also going to put on some gloves. But at home, you're going to have nice clean hands, so you won't necessarily need to wear gloves at all. How's that sound? Good. All right, so the first thing with scrapes and cuts you want to do is make sure that they're not bleeding anymore. So you can hold some gentle pressure with a paper towel at home. I'm going to have Nurse Sandy give me some gauze here. We're going to hold pressure on. And with a scrape like this, sometimes it's already stopped bleeding, but for a little bit of a deeper scrape or cut, sometimes you have to hold it a little bit longer. But again, gentle, and you don't want to rub on it because that can actually make it start bleeding all over again. Very good. All right. Also, if it does have any dirt or gravel or anything in it, you can just rinse it off in the sink with water to try to help get things out. You can also use a Q-tip or again, the edge of a paper towel to kind of clean out any debris there. Here we'll use a Q-tip just to make sure that we can get out that last little bit of dirt I see right there. And again, you don't want to rub it. You just want to gently take the dirt and get it out. Sometimes you might have some tweezers at home and be able to take any deeper dirt out of it, but most of the time it'll just come out with water. All right, perfect. Then you want to dry it off, especially if you've rinsed under the sink water, right? Again, gently hold some pressure. And don't rub it because you don't want to make it start bleeding all over again, right? So gently hold pressure. Awesome, very good. This is petroleum jelly or antibiotic ointment or cream, and that should be in your first aid kit as well. You're gonna take some, put it on your clean finger or on a Q-tip, and you're gonna gently blot it on there. Again, you don't wanna rub it because you can make it all bleed again. So you're just gonna blot it on there to help it heal, and it also may decrease scarring too. Then we're gonna get our bandage. We've got our Cougar Red bandage here. And those you can take and put over. Perfect, and that will help protect it and keep it dry and clean as well, so it'll heal faster. The other good thing is at least once a day, change this bandage. Or if it gets wet, say you're outside playing or you have a shower, you wash those hands again, it rolls up your arm, take it off if it's wet, take it off if it's dirty, and put on a clean one. But at least once a day, put on a clean dressing. And when you change it, you can always put on a little more petroleum jelly or ointment, antibiotic ointment to keep it healthy and decrease scarring and also decrease any infection. So to infection, red is a great cougar color, and it's a great color to wear. It's a great color for your bandage, but where you do not want red is around your boo-boos, right? Around those scrapes and abrasions. If it starts getting red around it, that can be a sign of infection, and that's a reason why you would want to come back and visit Dr. Pilkington or Nurse Sandy, okay? And we will give you a first aid kit to go home with, and that way you can learn to do this on your own for the small scrapes and boo-boos. All right, but for now, this looks great. I think you're gonna heal in no time. You've been an excellent patient today. Any concerns you have? All good. All right, perfect. Go Cougs.